Julia.
Carter.
And I'm Danielle, and we're going to teach you about antibiotic resistance. So before we begin, we would just like to give you a brief background. Antibiotic resistance is a selection process in which bacteria become impervious to drugs that are built to kill them. According to the World Health Organization, it is an increasingly serious threat to global public health because resistant bacteria prosper and the normal bacteria are killed. The number of bacteria that have become resistant to antibiotics has increased drastically in the last few decades. Many bacterial infections are becoming impervious to the most commonly prescribed antibiotic treatments. In the following example, you will learn about why this phenomenon takes place.
Hi, doctor. I really haven't been feeling well lately. I don't know what's wrong.
All right, so let's have a look. It looks like you have a bacterial infection. Usually when people have bacterial infections, I prescribe them antibiotics before the bacteria replicates. However, there are many different kinds of bacteria and antibiotics, so let's have a closer look to see what antibiotics you're prescribing.
There are two different types of bacteria, gram-positive and gram-negative. We will study the bacteria in Julia's body to see which one she has. Gram-positive bacteria have a very thick peptidoglycan layer, while gram-negative bacteria have a very thin peptidoglycan layer. Furthermore, gram-negative bacteria have an outer membrane, while gram-positive bacteria do not.
So, doctor, what kind of bacterial infection do I have?
Well, I took a closer look at the bacteria. There seems to be no outer membrane and a very thick peptidoglycan layer. So, according to these observations, you should have a gram-positive bacterial infection.
So what does that mean? What do I do now?
We'll have to take a closer look to see what kind of antibiotic to prescribe you.
There are two different types of antibiotics. Aminoglycosides are a category of antibiotics which act by inhibiting bacterial protein synthesis. They are effective against both gram-positive and gram-negative bacteria, but are more commonly used to fight gram-negative bacteria. Beta-lactams are the other type of antibiotics. They act by inhibiting cell wall synthesis. Unlike aminoglycosides, beta-lactams are only effective against gram-positive bacteria.
Though both an aminoglycoside and a beta-lactam would be effective in your treatment, I'm going to prescribe you penicillin, just because there are less side effects with the beta-lactam treatment.
Okay, thank you, doctor. Hopefully I feel better soon.
You'll start to feel better in no time, but make sure you take your whole course of antibiotics.
1 week later.
Hi again, doctor. I'm the most unlucky patient ever. I think I have another bacterial infection.
Well, let me ask you this first. Did you take your whole course of antibiotics?
Well, I took the first 2 days of my doses, and then I started to feel better, so I stopped.
Oh no, I told you to take your full dose.
But why? I was feeling fine.
Well, when you don't finish your antibiotics, resistant bacteria start multiplying, resulting in bacteria that no longer respond to the antibiotics.
But why do I even have resistant bacteria in the first place?
Bacteria can acquire resistance through mutation of other genetic material. Though mutations occur rarely, they still do occur. DNA affects how an organism looks and behaves, so a change in its genetic material can cause changes in all aspects of its life. For example, making it resistant to the penicillin I prescribe you.
But I don't understand why that caused my infection to come back.
Well, when you take antibiotics, the sensitive bacteria are killed, but the resistant ones are left to grow and multiply. Therefore, antibiotic resistance spreads when new generations inherit the antibiotic-resistant genes, or when bacteria share or exchange sections of material with other bacteria. So basically, when you stop taking your antibiotics, the resistant germs passed on the resistant genes to the new generation, and now you have even more resistant bacteria.
Oh no, I shouldn't have stopped taking my antibiotic. What do I do now?
Well, I'm going to prescribe you amoxicillin, which is another beta-lactam. But make sure you take your whole course of antibiotics this time.
Okay, doctor, I promise.
Now you can see why antibiotic resistance is becoming an increasingly serious threat. The repeated and improper use of antibiotics, as in the case just shown, is the primary cause of increase in drug-resistant bacteria. If this continues, antibiotics will become completely ineffective in treating bacterial infections. But on a more positive note, at least we know that all 300 of you will never make that mistake.
Now we have a pool everywhere.